Welcome everyone to one of several virtual oral presentations prepared for the 2016 ANA Conference, Quality, Safety, and Staffing. This session is Abstracts, Writing for Acceptance. My name is Roz, and I will be your moderator for this session. This presentation will last 30 minutes. To earn contact hours for this session, you must be registered for the conference and pay any required fees, complete the entire activity, log into the online CE evaluation system and complete the evaluation for this session, VO 101. See the conference program for other details. The contact hours will be awarded with the rest of your conference CNE credits. You may print out your certificate when you have completed the evaluation and entered all of your sessions. 0.50 contact hours are awarded for this continuing nursing education activity. The planners and presenter of this CNE activity have disclosed no relevant financial, professional, or personal relationships with any commercial companies pertaining to this activity. And now I'd like to introduce you to our expert speaker, Dr. Beth Quatrara. Beth Quatrara, DNP, RN, CMSRN, ACNS, BC, is a clinical nurse specialist with 17 years of advanced practice experience. She is director of the Nursing Research Mentorship Program at the University of Virginia Medical Center. She became the director of the program in 2002. Since that time, she has assisted more than 20 teams of nurses in the research process, from question development through dissemination. Dr. Quatrara also holds a joint appointment at the University of Virginia School of Nursing, where she teaches in both the undergraduate and graduate nursing programs. We are delighted to have Dr. Beth Quatrara with us today to discuss abstracts. Beth, I'll now turn the program over to you.
Thank you, Roz, and thank you everyone for making time to join in. The overarching goal of this presentation is to provide you with some pearls to help increase your likelihood of a successful abstract submission. Really, the goal here is to help you understand what you need to do to successfully submit an abstract that will get you published, get you to the conference you want to be at, or to meet any other professional needs you might have in mind. The objectives are to state elements of a strong abstract and for you to be able to identify strategies for developing a strong abstract. Our hope is that this will be an informative for those of you who are new to abstract writing, but also hope that those of you who are seasoned will walk away with a few new pearls and perspectives. So what is an abstract? An abstract is a high-level summary. It's taking your work and very briefly but thoroughly putting it to paper. It's not a comprehensive, detailed explanation of all elements of your project, but it's a standalone communication that an individual can look at and at a quick glance quickly understand what you've done, why you've done it, and what the results are. As I was looking up abstract, one interesting definition came to light, and that was the definition of an abstract as a work of art. I thought that was especially pertinent. As you think about what you want your abstract to be, and you really do want it to be a work of art, you want it to be that synopsis of your work that really draws people in. Your abstract is typically written at the completion of your work. And so in doing so, you have to be writing an abstract about a project that is completed in which you have outcomes to report. An abstract is not a reflection of an idea or a plan. Those are great, but an abstract is just not the forum for them. With an abstract, you always want to be presenting your completed work. An abstract can serve multiple purposes. Here we're predominantly going to be talking about an abstract as you submit it for a conference, but abstracts are also submitted for journals as well and are often the key introduction to a journal article. When you write your abstract, you want to be sure that it's clear. And you certainly want to avoid abstracts that are difficult to understand and are obscure. So what we're going to do is walk you through the key elements of an abstract that are going to help it become very clear. Abstract writing is a process. It is a process that takes time, and as such, you need to make time to do it. It can't be rushed. It can't be last minute. And you really need to map out a schedule. The ideal schedule is going to take about 5 to 6 weeks. So you really need to plan for that allotted amount of time. If you see a call for abstracts come out and the submission date is in the middle of December, you need to start your timeline for preparing as the first week in November. You really need to map out that 5 to 6 week timeline working backwards from the submission date. And the reason I suggest taking that much time is that so you can successfully complete the needed steps. One of the first things you want to do is you want to seek input. You want to consult with somebody else about what to write and about what aspects of your project you really want to include. Once you have the right concept for your abstract, you want to start writing. And once you have your abstract written, you want to share a draft with a valued peer, because you want that peer to be sure that your abstract reads clearly, that it flows well, and that it doesn't have any errors, including spelling errors. We often think of spell check as our friend, but oftentimes it's not our friend. So looking for things as minor as spelling errors is so important. And lastly, you also want to leave time to rewrite it. You want to take that feedback you've received and adjust your abstract to incorporate that feedback. You really can't wait till the last hour to submit. By establishing a timeline, by planning ahead, you allow for life to happen, right? Because things come up, and so you want to account for that. You also want to account for potential technical glitches that occur with your computer, with the online system you may be submitting to. Bumps in the road do happen, so map out a plan and allow for time. You also want to submit to one conference at a time. So as you map out your plan, map out a timeline that includes when do you anticipate hearing back about that abstract, so that if you're not successful and you need to rewrite it for another conference or to plan it for that same conference in a year or so to come, you want to be mindful of that. So take those points into consideration. You also want to be sure that you have the right fit, and that starts with the right project. You want to share an innovative project. It shouldn't be a project that you're sitting around laboring, thinking about. When you see that call for abstracts come out, there should be a project that pops to your mind. It should be a project that's been identified as strong work, something that your peers or leadership have really placed accolades around. It should be something that is worthy of sharing on a national scale, something that is informative to others. You also want to think about the type of audience to which you are going to submit your abstract. You want to present it to your work. You want it to be targeted to the right audience. So are you looking to speak to clinicians? Are you looking to speak to managers? Are you looking to speak to executives? And that may be very different from the message you'd want to send to educators or researchers. So think very much about who's the audience for this conference and how does your work match with that audience. You also want to make sure that your project fits with the type of conference. So for example, if you have an innovative project around let's say a creative staffing model, you're not going to submit that to a nursing informatics conference unless there was some new online system that contributed to your creative staffing model. But unless you can make those type of linkages, you really want to avoid crossing themes and conferences that don't match well. Once you've identified the right conference, you want to think about the themes and what is the theme of that conference. Conferences typically have annual themes. And does your project match that theme? Or can your project somehow be presented in a manner that emphasizes the theme? Is there an angle that you can take on your project that will help to match with that theme? As you're submitting your abstract, you also want to look at conference headings. Conferences often ask for abstract submissions within section headings. Is this a research project? Is it an educational project? Is it a professional development project? And so you have to think about how that fits. Again, if your project is a creative staffing model, that may not fit into an educational heading. So think about how it matches, or what angle, what approach might you take with your project that would help it to become a better match. The title. The title is so important. And although I mentioned it at this point, the title does not necessarily need to be written before the rest of the abstract. Some people find it more helpful to write it at the end. I personally like to put it at the beginning, but I think this is a little bit up to the writer. I don't necessarily know that there is a right or wrong with it. But the title is so important. You want your title to be one that it's going to attract the reader in. You want to draw them in so that they're eager to read your abstract. You want the title to be catchy. You want it to be descriptive. You want to send a clear message through that title. And you might consider, as we talked about themes a little bit ago, the conference theme, you might want to think about crafting it to coincide with your conference theme. You definitely want to keep the length of the title in check. Titles that are too short don't give enough information. Titles that are too long can just be wordy and distracting. And you definitely don't want to incorporate your title into your abstract. The title stands apart from the abstract and should just draw the reader in. It's not a lot of words and themes that are from within the abstract itself. When I talked about how connecting it with a conference theme, that can be a little bit tricky. You don't necessarily want to repeat the conference theme in your title itself. But if you take the American Nurses Association conference theme for this year, connecting quality, safety, and staffing to improve outcomes, if you were moving ahead with something such as a creative staffing model, maybe a title would be something along the lines of making a connection, a creative staffing model to improve outcomes. You know, again, pulling off the word connection, mentioning outcomes, helping individuals to see that this abstract belongs at this conference can sometimes be helpful. Unfortunately, though, if you don't have a good title, what can happen is that the abstract is essentially pulled down, that the reader from the start doesn't have a good idea of what you're writing about or the benefits of your work. So that title is really important. Again, it draws the reader in. So we look at the examples here. The first title, Improving Supply Efficiency, it's too short. It leaves many questions in the reader's mind. Are we even talking about healthcare supplies? And if we are we talking about operating room supplies, ophthalmology clinic supplies, dialysis center? We don't know. And we also don't know what efficiency is. Is it efficiency in terms of how and when the supplies are used, delivered? Who are they efficient for? The patient, the staff? It just leaves with many more questions than it does answers. The reverse holds true for the second one. The second title there it's just too long. That second title is almost the abstract in and of itself. It leaves with little desire to read the abstract because you feel you already know the story of the project. It's not almost that teaser that you see in the last one. The last one of make haste, not waste, bringing supplies to the clinicians. It's catchy. It's interesting. And it makes you want to hear more. And so that's what you're looking for in the title. You want to leave the reader wanting to know more about your work. Once you have identified the title and identified the format required and the essential elements needed, you want to look at the conference template, and you want to look at that clearly. Each conference is a little bit different, so you want to pay special attention to the template and the elements within it. Some of the common elements are listed here below, but variations do exist, so you definitely want to look at them before you begin to write. Write your abstract as the conference is directing you, because you don't want to waste time. You don't want to write an abstract and have to rewrite it. So follow the conference template from the start. The introduction. So after the title, the introduction is really the first piece of your abstract. You want your introduction to be brief. It is the background information. It really lays the groundwork and creates the tone. It's the setting for your story. You want it to tell, why is the project important? So why would others be interested in this topic? Why would others outside your institution be interested in the project? Is there a national or a global issue that's considered within the context of the work? For example, the Joint Commission reports, the CDC may state healthcare reform targets, or maybe you talk about heart failure. Maybe it's, making note of what % of the population currently has heart failure, and therefore why your work in the management of patients with heart failure is important. Again, put it in some type of global perspective. Really helps to create relevance for your target audience. The problem statement. I really can't emphasize enough how important this problem statement is, because it loops back later. And I'll talk about that, but just know that I put a big asterisk when I think about problem statement, because it is so important. The clarity and precision here is really essential. It is the description of the issue that requires resolution. It's used later, as I alluded to evaluate the success of an outcome. Sometimes it's maybe listed as a goal, maybe listed as an objective. And you can actually have more than one problem statement, right? We certainly all work in clinical settings where there's more than one problem at one point in time, and sometimes we're implementing something to target more than one problem. So you could include more than one problem statement. If you do, number them as such. If there's more than one, number at 1, then number at 2, and that's helpful because when you do loop back later, again, you can use those same numbers and create that linkage. The methods. The methods is the step-by-step of what you did. Chronicity is very important here. You want to establish a timeline. You want an order for your actions. If you did something such as developing an innovative staffing model, who are the team members? How did they design the model? What does the model look like? And finally, when and where did they test it? It's important in the methods, as you're describing your process. That's what the methods is, your step-by-step, chronologically paced process. It's important you do not write in the first person. You want to avoid words I and we. Instead, think of terms such as the team, the nurses. Use those third-person terms. The results are the output or the end product of your work. It's very important that you link your results back up to the problem statement, because here is where you showcase whether or not you met the goal of your project. It's okay if you didn't. That's reality. We don't all always succeed with these projects. Sometimes we partially reach our goal. Sometimes we don't reach our goal at all. And those abstracts and that work is equally important to share because we have to help one another from not making those same mistakes. So regardless of what your results are, don't shy away from sharing them, but be clear on them and clearly link them back to your problem statement. Numbers are powerful. Whenever possible, include your numbers. Numbers speak volumes. If you decreased something, if you increased something, spell that out. Time frames are also important, and quantify that time frame. Did something occur over a year? Did you see a change over a year? Have you seen a change over 2 quarters? Whatever it is, spell it out. And you'll want to demonstrate consistency in that change, particularly if it was success. Your colleagues will want to know that it wasn't just happenstance, that there was an intentional project with a lasting outcome. Because as your colleagues are looking at whether or not they want to learn more about this or potentially replicate this, they want to know what the effects are. So spell that out, talk about that consistency. You also want to be clear that you are listing outcomes, not process measures, and that is an important difference. Outcomes, again, if I refer to that staffing model example that I've been pulling through here, you might want to say something such as, with the implementation of the staffing model, there was a decrease in turnover. By what percent or by what numbers? Those numbers are powerful. Or there was an increase in continuity of care, therefore there was an increase in patient satisfaction. Those are outcome-type measures as opposed to process measures, which would say something such as 30 staff members participated in the staffing model, or the staffing model was in effect for 4 months. Those are process. That tells us more of what was going on in the methods as opposed to the end product. So just to clarify that point and help you to focus on that true outcome. The last piece you're going to write is your conclusion. And your conclusion is really where you get to tie it all together. It's your synopsis, and you get to highlight the results, interpret the results, help explain what may or may not have been going on in the results, and how it can be applied to others. This is, again, your chance, similar with your introduction where you try to create that more of a global linkage. You want to do the same in your conclusion. What does this mean for others? What future work may need to be done as a result? Those are all examples of components that could be included in your conclusion. Here we have an example of why all of the elements within your abstract really need to be visibly woven together. The example on the left would be what I can always consider true, true, and unrelated. Sometimes you look at an abstract and you think, well, problem statement, that's a fact. Methods, that's a fact. Results, that's a fact. But you can't find a relation within them. Here on the left-hand side, we talk about a problem of healthcare-acquired infections being above the mean. Talks about the introduction of new documentation system, and then the results decreasing of infections. But again, it doesn't link through to really explain how is any of that connected. If you look at the example on the right-hand side, it's much clearer. It talks about exactly what type of infections, abdominal surgical site infections, talks about what type of mean you're looking at, the National Healthcare Safety Network mean through the CDC. I do want to highlight that an abbreviation is used here, but it's used after being spelled out for the first time. The methods section helps you to truly see how that new documentation system could have contributed or did contribute to the result. How did that new documentation system have an effect on surgical site infections? And then the results, again, link back up to the problem statement, clearly referencing a potential or real change in that mean. So that linkage really flows all the way through. This one may sound basic, but it is sometimes ignored, or more commonly I think readers just are quickly reading guidelines for conferences. But if you don't follow the directions, your abstract will be readily rejected. And if you're going to make this time investment in your abstract, you don't want it to be rejected because you didn't follow the guidelines. So do read them carefully. In terms of format, in terms of word count, there are typically word count limits, and you want to be within those word count limits and understand what is and is not included in terms of word count. Does it include titles or not? Things such as that. So read it carefully and pay attention. You also want to look at submission style. Can you freely upload a Word type document, or do you need to paragraph by paragraph submit your work? You want to understand that before you submit. You also want to be mindful of authors and authorship. Authors are very different than the people you would like to acknowledge for your work. There's plenty of time, if your abstract is accepted, to acknowledge those who contributed. That can happen within the final product. But authorship, you need to include the appropriate authors. You need to include all of those who substantially contributed to the product, who were actively involved in the writing, whether drafting, editing, or writing from the start, and also those who reviewed the final draft. Authors need to meet all three requirements. And so often projects do have more than one author, but in terms of writing it, you want to make sure you include those three components as well. Copyright is something to be mindful of. You want to be cognizant of conference documents and rules when you are submitting so that you understand copyright that may be related to your abstract submission. So read those guidelines carefully. You don't want to get in trouble at that spot. You've worked too hard at this point to get caught up there. In your final review of the abstract, you want to make sure that your abstract is relevant. Again, link back to those conference themes. Think about how does it reach out globally? What impact does it have on others? Why would others care? You want to make sure your project is innovative. You want to make sure your grammar is correct and use full sentences. In healthcare, we use a lot of jargon on a daily basis. We throw out all sorts of abbreviations, but now is not the time for it. Now is the time to write like a professional. So use full sentences, avoid jargon, acronyms, and abbreviations. As I've mentioned, avoid the first person, and also want to avoid passive voice. Typically, abstracts have limited references. Many abstracts don't have any references. However, you do have something that is hot off the press or not globally understood, you may want to reference it, particularly if it's a new finding, if the Institute of Medicine has just reported something, if the World Health Organization has just reported something that may not be well known, you may want to reference it, but not necessarily a new randomized controlled trial that was published recently. Again, just something on a grander scale you might want to reference. You definitely want to make sure that your abstract is factually accurate and that there's distinct linkages. You don't want to create any false assumptions in your work. Again, your name is going to be on this work, and so you want to be very professional, have lots of great integrity with it, and really put your best foot forward. You also want to essentially blind it. You don't want to have your organizational name on it. You don't want to have any vendor names either. This is work that should be void of those names. Once you've reviewed it very well and you think it's ready for submission, you want somebody else to review it, and I highly recommend the internal peer review. I recommend that you find a trusted colleague or an experienced abstract writer, someone from whom you value and will be able to incorporate some constructive feedback. You want to ask them to review it. As a person who's not at all involved in the project, what is their understanding of it? Are you giving them enough information, and is it clear? You want to ask if it flows smoothly. Does it appear to be in the right chronological order? You want to ask them to help you eliminate any unnecessary words, particularly if you're struggling with that word count. Remove those superfluous words. This is not a time for creative writing. This is a time for using only the necessary words to clearly delineate your work. You want to focus on the essential elements and make sure that your work is going to apply to a broad and an unfamiliar audience. And last but not least, edit it one more time. You're going to get some feedback from the internal peer review, and take that feedback. You don't necessarily have to incorporate all of it if it's a happy to glad type change, but most of these elements you do want to go ahead and incorporate. So be cognizant of that. Be thoughtful about what you include and don't include. You want to review those guidelines again one more time. Make sure you're meeting the requirements of the conference itself. Once you think you have all of that, you're ready to submit. And so, congratulations. I certainly hope that this information has been helpful to you. I wish you great success as you begin the process of abstract development and submission, and certainly hope to see your work at future conferences. Thank you so much.
And thank you, Dr. Quatrara, for discussing abstracts writing for acceptance. And thanks to all of you for listening to this session and for attending the conference. You may obtain contact hours for this session by checking VO101 on your conference evaluation. Please retain your badge or your registration receipt, as they have information for you which you will need to log into the evaluation system. We hope this information was helpful, and please check out the other virtual oral offerings on the conference app.